back, and I'm delighted to be able to introduce our next series or next session, which is one of my favorites. Every year, we always do a session that we call "Listen to the Spectrum." And one of the things that I know, again, being doing the work that I do, being a part of this amazing community, is that listening is really, really important, right? And so, thinking about all the things that listening to different perspectives, especially those perspectives of people on the spectrum is really important. Last year, we had an incredible panel, both led by Stephen Shore, similar to what you're going to hear in just a minute, and then a second one led among parents of individuals who are considered to be profoundly autistic, which, again, for those of you who may or may not be deeply enmeshed in our autism community, that's a newer term, but a term that describes individuals who require 24/7 supports. And so certainly what you're going to hear through this next session called Listen to the Spectrum, you're going to definitely hear people who have a voice. You have folks that are able to communicate in different ways, whether that's through their words, whether that's through typing. But what I want us to remember, as we've been doing all day, is that there are opportunities for us to grow and to learn and to listen. And so I'm really excited to be able to introduce this next fabulous group of people. So let me do just that. So we're going to have a group of individuals, and I'm first going to introduce Dr. Stephen Shore. Dr. Stephen Shore has become a really great friend. We've learned a lot together over the years, but he was diagnosed with atypical development and strong autistic tendencies, and was determined to be too sick for outpatient treatment, which is honestly shocking when you think about all that Dr. Shore has accomplished and contributed to not just the field of autism, but our world. And so that's an important thing for us to remember, that while we have a long way to go, we have come a long way. Dr. Shore was recommended for institutionalization, non-speaking until age 4, and with much support from his parents, teachers, wife, and others. Stephen is now a full-time professor at Adolphi University and adjunct at NYU Steinhardt School of Culture, Education, and Human Development. He focuses on aligning best practices and supporting autistic people to lead fulfilling and productive lives. In addition to working with children and talking about life on the autism spectrum, Stephen is an internationally renowned educator, consultant, and author on lifespan issues pertinent to education, relationships, employment, and self-advocacy. His most recent book, College for Students with Disabilities, combines personal stories and research for promoting success in higher education. He's a current board member for Autism Speaks, the Organization for Autism Research, or OAR, the American Occupational Therapy Foundation, the President Emeritus of the Autism and Asperger's Network, and an advisory board member of the Autism Society. Dr. Shore also serves on the advisory boards for AANE and other autism-related organizations. Ariel Spear is a licensed clinical social worker with a background in direct care support for autistic persons, and identified her own experiences of autism while raising her autistic adult son. Ariel became passionate about gaining her higher education to increase her ability to advocate with mental health professionals to support her son. Ariel has completed academic research to increase insight into students with disabilities and the reluctance to accept disability services. Ariel recognizes the best way she can advocate for her son and herself is to be visible as an autistic person with disabilities, to challenge stigma and represent what being autistic, dyslexic, having ADHD, OCD, and having dyscalculia can look like. Ariel currently works as a clinician for Prosper Health, offering neurodivergent affirming therapy for adults. Chris Gwen is an LGBTQ and disability justice advocate. He has founded Queerability and has worked with organizations like the Autistic Self-Advocacy Network, as well as GLSEN and the National LGBTQ Task Force. He currently works at the American Psychological Association and their journals department. When not working or advocating for LGBTQ and disability justice, Chris enjoys music of all genres, going to concerts, and playing musical instruments. Nicole Noblet lives in Kansas City, Missouri, go Kansas City, and works at ETAS, the Jackson County Developmental Disabilities Services, as a peer resource specialist and as an election judge in Clay County. She is a member of People First, and her advocacy focuses on voting rights and alternatives to guardianship. She enjoys spending time with her family, including her pit bull named Pebble. Her hobbies include knitting, quilting, and art, and she's involved in Special Olympics Missouri and she competes in unified sports with her mom. So for the next 45 minutes or so, we are going to have a great discussion among these incredible advocates. Listen to the spectrum, see possibilities in all abilities. So I'm going to turn it over to our esteemed guests, and I look forward to hearing from you.
All right, well, thank you for such a great introduction, Kristen, and I look forward to an excellent and stimulating conversation with Chris, Nicole, and Ariel. So we've got some questions here to look at, and the first one is, what misconceptions do you feel people have about autistic people?
Yeah, thanks, and thanks, Echo Autism, for inviting us. I think, as you heard, I am also an LGBTQ activist, and I think, while we have come a long way in recognizing the diversity within the autism community, I think we still have a long ways to go. I think that recognizing that autism isn't the only part of many of us, is, we are also LGBT or a person of color, or we have, so many other facets of who we are. And I think that is something that, I think that a lot of people have misconceptions about. Yeah, so I think just recognizing the diversity within the autism community.
All right, thank you very much. Great answer, and that diversity word is so important. And with that coming intersectionality, in that autism affects every part of our lives, but autism is not all we are.
Yeah.
All right, we move on to Nicole.
People assume that because I use augmented and alternative communication, or AAC, to communicate, that one, I can't talk and therefore have nothing meaningful to contribute, and two, that I have never talked and have always used AAC. I use AAC because I experienced a traumatic brain injury and have difficulty getting the words from my brain to my mouth. And even when I do, the words are often unintelligible to anyone besides my mom. And due to my illnesses, if I'm trying to use my voice to talk, incredibly exhausting, and prefer to use my AAC. People think that there are two types of autistics: those who are, by some, deemed high functioning and thus must not have any support needs, and those deemed low functioning and must not have anything meaningful to contribute.
All right, thank you very much, Nicole. You said some very important things, and I'm glad that you're using AAC. AAC is a great enabling device that allows you and other autistic individuals who don't speak, but certainly even if the person doesn't speak, we still likely have much to say. And the high functioning and low functioning conundrum, I think we're just better off getting away from ranking people in terms of functioning and more about considering what support needs autistic individuals may need. Talking about high and low functioning autism, you might say, is a low functioning way of talking about autism. All right, now we're on to Ariel.
I think some of the biggest misconceptions are found in the expectations of what autistic features look like. And many times I've heard people are dismissed when they talk about being autistic or thinking they're autistic because they don't exhibit certain specific features that have been disseminated through things like movies and TV. And there's also areas related to the diagnostic criteria that I've identified that research is still working on catching up to. And in particular, there is a belief that individuals with autism struggle with empathy or have a hard time understanding their feelings or those of others. And there is some research on what is called the alexithymia hypothesis that has found that alexithymia rather than autism is the best explanation for these features. And alexithymia has 7 components, and some of those are things like identifying emotions in self and others, difficulty with empathy, difficulty engaging in fantasy, and difficulty interpreting vocal tone. And while about 51% of autistic people do experience alexithymia, research has shown that alexithymia, when it's accounted for, that actually autistic individuals do not report these same experiences. So I think that this signifies how the stigma can contribute to the invalidation of people when they're disclosing, talking about being autistic or think that they are autistic, and that might impact them getting services or an evaluation that they might need. And another experience I've had is being dismissed when I share my own limitations with others. I found that people are either in disbelief or they just don't take me seriously when I express how overwhelmed I am by sensory experiences. And I'm often faced with an opinion that, because I appear to be higher functioning, that I really just don't need the support needs that I'm expressing that I need.
All right, thank you very much for your detailed contribution. And certainly, I think the only thing that we can expect about autistic features is that we're going to find incredible diversity within the autism spectrum. Empathy, we've got a long way to go, but we're slowly beginning to understand what empathy is for autistic individuals. And if anything, what I often see happen is that an autistic person might sort of blend or glom onto how another person is feeling, perhaps get so overloaded by that feeling, and that might cause a shutdown. And it seems like that we're not empathetic, but actually, in many cases, we may be over empathetic and fusing with another person's emotions. So as we think about the misconceptions of autism, perhaps one of the most important things we can keep in mind is that in consideration of the diversity of autistic individuals, when you've met one autistic person, you've met one autistic person. All right, we're moving on to question number 2. What barriers have you encountered in accessing services, and how have you overcome obstacles? And Chris, it looks like you're on.
Yeah, I've definitely encountered my fair share or unfair share of hurdles in accessing services. I think one of the more pressing ones is in healthcare. As a transgender person and as an autistic person, navigating healthcare is quite a feat. In order for me to receive my hormones, I have to have a diagnosis of gender identity disorder on my or gender dysphoria on my medical record. And having that in conjunction with something like autism that leaves me vulnerable to all sorts of biases, not just in relation to my disabilities, but also in relation to my being trans. And so I've had to make the hard decision to just keep my transgender identity on my medical record, because I kind of have to in order to receive my hormones. So I've had to opt to withhold my autism diagnosis from my medical providers, even though it would be very helpful for them to understand this aspect of who I am. But I am in fear of, any kind of future bias or discrimination I might experience as I go throughout healthcare. So in order for me to get the kind of support that I need as an autistic person, I have to phrase my questions or my support requests very delicately. I have to say things like, "Oh, I have a hard time with understanding verbal instructions. Could you give me written instructions instead of saying, oh, I am autistic and so I need this kind of support. So I have to express the need for support without mentioning why I need that support. And so I think that is one thing that, people need to consider, with whenever they're advocating for healthcare access for autistic people, is just the layers that we have to deal with.
All right, Chris, and there's so many layers, and I like how you emphasized the in as part of unfair share of hurdles in accessing healthcare. That is what is most on the minds of us autistic people, is finding ways, making sure that we can access healthcare, both literally getting to it and also from professionals who understand what autism is. And I think you also gave a great example of self-advocacy when you told that doctor that you much prefer to have his instructions in writing as opposed to verbally, because that's how you better process information. All right, on that note, we move on to Nicole.
I have several chronic illnesses in addition to being autistic, so I do a lot of doctors. Most healthcare providers don't know how to treat people with intellectual and developmental disabilities and will talk to my mom instead of me. I used to let them because it is exhausting repeating my story over and over, and most of the time the doctors don't listen anyway. I went through a lot of doctors before I found ones that actually directed their questions to me and were patient with me, waiting for me to type my answer on my AAC device. I have had to tell healthcare providers that I am capable of speaking for myself and that they need to speak to me rather than the person with me. It wasn't until I started using AAC that I felt comfortable talking to my doctors, and once I did, many of them were able to communicate better with me too.
All right, thank you so much, Nicole. And that is such a challenge that so many of us face to a certain degree. That is as people have a question, asking the autistic independent of something that the autistic person has chosen to do will bring the important aspect of many have occurred conditions. Then on to Ariel.
Thank you. I remember in my initial consultation for an autism evaluation, the provider said to me that I made really good eye contact, implying that I made really good eye contact for being an autistic person. And I had to explain that even though it can be difficult for me at times to make eye contact, that I understand it's an expectation and something that makes other people comfortable and feel listened to. So as part of the masking that I have experienced, over time, is making myself do that. So I found that it's surprising that actually there's a lot of the same misconceptions even within the mental health care field when working with providers. And even if they do have an understanding of autism to some degree, a lot of times that tends to be focused on children rather than adults. And some other challenges include the difficulty to get evaluated for autism. The waiting process can be really lengthy, upwards of a year in some areas, and on average, the cost is about $2,000. And I've also experienced some of the providers expecting payment in full upfront, despite even if insurance had approved it, and that can be quite the barrier. I think it's important for mental health providers to realize that treatment for autism does need to be differentiated at times. I have experienced that there are quite a few mental health providers that aren't necessarily aware that of research by like Raymaker on autistic burnout, pointing out that while there's some overlap between depression and autistic burnout, that they, some treatment like behavioral activation can actually make autistic burnout worse. So I think it's important that providers are doing their best to try and keep up on recent research to see what we're learning. And then another barrier to service is being able to find treatment options near you. So once an adult is diagnosed with autism, then they face a very huge up battle of trying to navigate what services exist for autistic adults in their area. I know where I live in a smaller area, there really isn't much, other than maybe if someone needs to have direct care staff living with them to help them, or not living with them, but staying with them to help them be independent. And that oftentimes when people are trying to access other services after a late diagnosis, that they're then faced with having to justify why now they need these services, but they didn't have them before. Thank you.
All right, thank you very much for an information-packed contribution. And yes, we still run into the challenge of being discounted, discounting of our autism diagnoses because we make eye contact or we behave in a way that people are not expecting. And the important issue of masking, sure, well, many of us can learn make eye, but how much emotional and mental health cost. Access to mental health supports is what, or I should say lack of access, is what is most important on people's mind. I can hear you. Can you hear me?
Yeah, there's a little bit of a lag. And so it's picking itself back up every so often, but we might have to have you either maybe stop sharing your camera, which makes me
Mental health
sad.
support seems to be. All right, let's try that.
There you go.
Oh,
All right,
there we
let's do
go.
that.
All right. Mental health supports is most on the challenge, most on the minds of autistic individuals, as we found out through participatory research that Teal Benavides and I engaged in. And another area that we need to focus on as well, actively involving autistic individuals in all aspects of research that is being done with the autism community. Now we're on to question 3. What could professionals do to help you feel listened to, believed, and supported? And we begin with Chris.
Yeah, I think some of the ways that professionals can help us feel believed and supported is, as we said previously, recognizing that autism manifests in people differently, and it may not always be in the traditional ways that you expect. Validating our lived experiences and how we perceive and navigate the world. And knowing that, autistic people, try not to generalize too much, but we do typically mean what we say and say what we mean, and so you don't really have to read between the lines too much with us sometimes, and so yeah, I think those are some of the ways that professionals can help us feel listened to and believed and supported, and just listen to the individual that's right in front of you, listen to what their needs and their and to what their needs are, and just respond to that adequately.
All right, thanks for some great advice, Chris. And that's an important thing that we need to bring out, is the wide diversity of autism and how it shows up in different people. Yeah, all right. So Chris, focus on the great diversity of autism and how it just shows up differently in different people. Chris also had another comment about us saying what we mean and we mean what we say. There isn't hidden curriculum behind what we're talking about, but what you see is what you get. And then finally, the point of listening to the person in front of you. Get to know the person who is in front of you, instead of focusing on preconceived notions of what autism is or what autism isn't. So hopefully you all heard that, and we move
We
on to
did.
Nicole.
That was great, Stephen. We can hear you good now.
All right.
Professionals need to listen to autistic people. Even if we are not talking, we are communicating something. Be patient with us. It can take extra time for us to think and communicate our thoughts. It can be hard to describe abstract things such as pain. I have chronic pain and I don't understand the words doctors use to describe pain, like sharp or dull, and I can't point to the exact spot that is hurting. This makes it harder for doctors to help me, but please understand how frustrating it is for me to not be able to express how much pain I am in. And please believe me when I say I am in a 10 out of 10 pain.
All right. Thank you very much, Nicole. And you are so right. We are always communicating. Everybody is communicating. Even if we're doing nothing, that's still communicating. And that's important to realize for all of us. And due to some challenges we may have in communicating and using assistive communication devices, it may take us longer. So please, with us. And your point of difficulty in low pain, where in the body being hurt, so often we take for granted that a person is pretty well to indicate what part of the body hurts, what doesn't feel right. But for us autistic people, there can be difficulty in specifying where that pain is. So thank you for bringing that up. And we are now on to Ariel.
In addition to my own experience, having the pleasure of raising my 21-year-old autistic son, I think that the most helpful providers were the ones that treated my son and I as the experts of our own experiences. They truly listened to what we had to say. They're receptive to our insight, our suggestions. And I think it's important to recognize that we are still in the infancy of understanding autism and what the implications are for autistic brains and bodies. Therefore, it's critical that people are listening to the lived experiences and insights of autistic persons as they are invaluable. I feel the best way a provider can support me is by keeping up with research, as I said earlier, and educating themselves on autism, as well as listening and validating my experiences. If a provider is truly curious about my experience, rather than trying to fit me into a box or telling me what I should be experiencing, this is going to come across to me as them truly caring, which is going to make it easier for me to trust them and follow their recommendations.
All right. Thank you for a lot more good information. Yes, we are in our infancy of understanding autism, which suggests that listen to us, listen to our experiences, and do keep up with the research. Is what's most on autistic people's minds. We've also heard many other things, ranging from locating pain to the diversity of the autism spectrum and way we communicate. And finally, our focus on learn what to say. All right, we move to question number 4, which is do to focus not on weaknesses. And we begin with Chris.
Thanks, Stephen. I think you're cutting out a little bit more, but I can go ahead. I think that there are very few parts of being autistic that are 100% weaknesses. I think in 100% strengths. I think that there's a lot of overlap between all the different kinds of characteristics of autism. As we said before about empathy, I think that on the outside, when we are going through like what I call an empathy overload, a lot of people might think that is a weakness, but on the other hand, it's also a strength because it's demonstrating so much that we care deeply about people. And so I think that, it's hard to separate when there is uh, something that is 100% a strength and 100% a weakness. And so I think that people just having a more nuanced perspective on how we're presenting ourselves in the world, and how we're interacting with people, I think that could go a long way to seeing ourselves as, human, and that, we our um um our interactions and how we go throughout the world is not, this, really uh you know wrong way. It's, and it's not the right way. It's just our way. And so I think that's something that people can kind of start to adapt and work into how they go about their lives when they interact with autistic people, is trying to see all the nuances with how we interact with each other.
All right, Chris, such great advice and how we need to just look at those characteristics of autism. Not put not to put a value judgment on them. Are they good? Are. And the question is, what can we do with these characteristics, with the sometimes unexpected strengths? And you mentioned empathy overload is really about caring deep about people. We have many nuanced perspectives, and many times more. Finally, when you mentioned it's our way of doing how we do things, which makes me think that we just experience the world differently. It's necessarily a disordered way of being, but a different way of being. All right, now we're on to Nicole.
Stop using functioning labels. They do us a disservice and don't accurately reflect the support needs we have. Remember that all behavior is communication. Consider the why before you write us off as someone with high behaviors. We may not be able to tell you what is wrong with words. Please don't tell us you use our words. Gestures and vocalizations are just as valid as words. Do not finish my sentence, read over my shoulder, or touch my AAC device. This is rude, annoying, and disrespectful, and shows me that you don't really care what I have to say.
Hey, thanks for some great advice. You meant to stop using functioning labels, specifically high and low functioning. I know many people who have been one or other, and it really oversimplifies and doesn't explain who they are. Autistic person who has IQ of over 200. Those of you familiar with scoring IQ tests know that they don't know that, it's just a guess. But at the same time, he has such challenges in understanding typical social interaction, sensory challenges, that she's never going to find employment the way we think about finding and keeping a job. So using a functioning label it just is not helpful. And likewise, functioning, I know so many people were considering functioning and giving up on for being too much of something and not enough of something else. And often when we find a way for these individuals to communicate, we have the same range of intelligence as everybody else. So if we function, maybe we could talk about in low functioning environments that we can then adjust and make modifications to, so that autistic people can we can much access our abilities. You're so right about don't touch my AAC device. That's rude. It's disrespectful. It may take you time to get out the meaning of what you want to say using an AAC device. And but we have to be patient, and we'll be rewarded with the communication that occurs once you've said what you need to say. All right, so now moving on to Ariel.
I think that it's important for a provider to acknowledge that being autistic comes with plenty of challenges, and sometimes we just need to talk about that. But ruminating and focusing on the things that are causing us issues or problems over and over again can lead us to just feeling sad, disempowered, and even make us feel depressed. So, of course, when someone comes to you and they're struggling and they need validation and they need you to listen, that's what you need to do. But I think it's also helpful for me when a provider is able to highlight what is great about who I am and my differences, to get me to look at those, to be able to recognize my resiliency, the way that I've overcome things in the past, and to allow me to recognize the strategies to be able to overcome what I'm facing.
All right, so very important. We do have to acknowledge autism can bring significant challenges, as well as it can bring significant. And what I feel is that if we can turn away from the medical model of disability and disorder and deficit when thinking about autism, and turn towards a more social model and start by asking the question, what can the autistic person do? And then, of course, there'll be some challenges. And what we need to do is find ways to lower the barriers that those challenges that are preventing. We think of parents told by a medical professional that their child is autistic. It often starts with the past and the discussion about the limitations. And at the bottom, way at the bottom, maybe a list of strengths. But what if we flipped it and a doctor told a parent, or it could be an autistic person who's getting a suspected diagnosis verified. We've gone through our reports, and it shows us that you have some incredible strengths here, there, and somewhere else, 90th%. And these strengths will allow you to do these following activities pretty easily. We also noticed that there are some challenges over there, and noted that a lot of people have these, and there's many good strategies in which to accommodate for or for adjust or these challenges. And all of these characteristics line up with what is called autism. And that would present things in a much more positive light if we could go about it that way. I want to thank everybody for these amazing answers to these questions. Well thought out, so much advice that we home with us as we all go about supporting autistic individuals to lead fulfilling and productive lives and to make that the rule rather than the exception.
Absolutely. And so this is great because now we have a little bit of extra time for us to be able to take some questions from the participants. And so thank you for the discussion that we've had already. And I definitely am excited to hear a little bit more from you based on some of the questions that we've received. So the first question is, and I thought we'd kind of go around if that's okay with you guys. What do you feel are your greatest strengths as they relate to your autism? And I don't know if it's probably, I would assume it's kind of helpful if maybe I just go, let you know who I'm coming to first. So Chris, what do you think? You okay with taking that one first?
Yeah.
Okay.
I think that my greatest strength with my autism is how analytical I am. And it's helpful in my job. I work with a lot of really intense research in the journals department, and so I like how analytical I am, and I think deeply about all different kinds of facets of the situation and all angles. Sometimes I get a little too far and I think a little too deeply. But I think that being autistic is what makes me that way, and I wouldn't trade it for anything.
That's awesome. I love that. Thank you. All right, Ariel, how about you? What do you think?
I think my creativity, and it's interesting because I am ADHD, I have ADHD and autism, so some of those conflict sometimes. So I have a terrible memory, so I don't have that one, unfortunately. But I'm also really good at pattern recognition, and I found that the different companies I've worked with, I've actually had supervisors tell me that they counted on me to recognize the sort of differences and gaps in consistency, which usually meant that there was an issue there. And so that's, I think, one of my best strengths.
Love that. That's awesome. All right, Stephen, how about you? What do you think is your greatest strength as it relates to autism?
Well, I think some of my greatest strengths include being able to take information and explain it in a way that my students can understand. Autism also gives me great ability to make and enjoy music, to enjoy the environment with my sensory differences when I'm not being overloaded by something. And these are a couple of things that autism brings to me, and no, I wouldn't trade them for being non-autistic.
That's awesome. Thank you for
I
that. Nicole?
feel the same way about music with autism as Stephen does. As a musician myself, I love that I can hear all different kinds of notes and the textures in music. I love it.
That's so cool. I love that. That's neat. Thank you for sharing that. That's really cool. Okay, Nicole, what would you say is what you feel is the greatest strength and as it relates to autism?
A unique way of thinking about things and can often find solutions for problems that others might not think about.
Love it. Love it. Yep, that's amazing. And I think what I'm struck by is how each one of you, as I would expect, have and see different strengths between each other, right? And I think the next question I'm going to ask us about is this concept about kind of debunking myths that sometimes people think about autism. So I'm going to come to that question in just a minute, but I want to spend a little time here in this moment because I think it's common for people to make these broad assumptions about, oh, autistic people are really detail oriented. And yet we got to hear about, yeah, Chris, that's a huge strength for you, that analytical nature, but also that creative side. And then thinking about Ariel, thinking about your creative side, and then thinking outside the box. Those are all amazing traits. And they're all unique and they're different. And that's why I think, Stephen, you're my favorite quote, and probably the rest of the world's favorite quote. If you've seen one person with autism, you've seen one person, which, in some ways, as much as I love that quote, it's also not you are not annoying, but the quote itself makes me think, well, obviously, right? Like every one of us is unique and in an individual. And so the sheer fact that we have to have a albeit fantastic quote about people on the spectrum also kind of speaks to that lumping that I feel like a lot of people do when it comes to, oh, well, you can't be autistic because you make eye contact. Oh, you can't be autistic because you have friends. Or, I've heard a lot, as I'm sure you all have heard many, many things. And so the question that's come in is, what are some misconceptions about autism that we need to debunk? And how can we educate the public to help foster a greater understanding and acceptance? And so let's see. Ariel, do you want to go first?
Sure. I think some of the ones that stand out to me are, from my personal experience, my son was born very premature, and I think a lot of people, expected that he wouldn't be able to do anything or accomplish anything, and he's now working on his secondary education, not college yet, but preparatory. And I think that he's just shown that, like, given support, that someone that's autistic can accomplish a lot. And so this idea of limiting someone by what you think that they're capable of, I think, isn't fair.
Excellent. Okay. Nicole, what do you think? What are some of those common misconceptions that we need to try to debunk?
When someone tells me I don't look autistic, autism does not have a look.
Agreed. Agreed. Nicole, I'm going to ask a second question, and I'll go to Chris for his answer to the first one and then come back to you for yours. But I would love to hear your perspective on how people perceive you in using your ACC device, and how that, I just love to hear your perspective on that. And so I'll come back to that in a second. Chris, so first question. So thinking about those common misconceptions that frankly we could all stand to debunk within ourselves, but surely we can also all contribute to a broader public conversation. What do you think? What are those common misconceptions?
I think one that the general public has a lot is that we don't like being around people, but I think research has actually shown that autistic people, we actually value good interpersonal relationships more than the general population might. And it's just that it's often perceived that we don't like being around people because the sensory environment can often be a little overwhelming, and so then that causes us to shut down. So I think that is one big misconception that I would love to go away.
Yep, agreed. I love that. That's awesome. Stephen, what do you think? What are your common misconceptions you wish could be debunked?
Yeah, well, there is a misconception that autistic people don't have a sense of humor. So I think we need to debunk that. And, getting back to Chris's comment about we don't like being around people. And there are a lot of autistic people who do demonstrate that behavior, but I think what happens is that as in grade school, we're told over and over, you need to go and make friends, you need to make friends with your classmates, go and do it. And then when we try to do it, the probability of a bad result nears 100%. So eventually we think, well, all of this social interaction is not cracked up to what it's meant to be. And I wonder how the non-autistic population would respond if they had as many challenges with social interaction as we did.
I really appreciate your comment about autistic people not having a sense of humor. I actually have a quick dad joke I'd like to share.
Go for it.
About
Go
autism.
to it.
It's so despite my being autistic and having difficulty with eye contact, I still love jokes about eyes. The cornea, the better.
Yeah, that's pretty awful.
I loved it, but I'm also a major fan of dad jokes, so that was perfect. I love it. That was awesome. Okay, Nicole, give us some insight about the misconceptions that you may see or experience as someone who uses an alternative way of speaking.
A lot of people ask the person next to me, she can't talk, or they will ask me a question and are too impatient to wait for my response. This used to irritate me, but now I feel like if they don't want to hear what I have to say, that is their loss, and that when people actually hear me speak, they are impressed with what I have to say.
Yeah, agree, Nicole. Thank you for that. Really powerful. I wondered if that might be something like what you would share. And I think that's a lesson for all of us. I know that when I'm with my patients, um, I'm a fast talker. I have lots of things to say, and I have to consciously remind myself to slow down and wait and be patient. And I'm always rewarded. I know that's me centric, right? Like I'm rewarded with being patient. And so thank you for sharing that with us and reminding all of us that just because it takes longer doesn't mean you don't have something to say. And I think that's just really powerful. So thank you for that, Nicole. Okay, so we have time for a couple more questions, which again, I'm delighted about. And so there's I have a couple that I'm hoping we can get to, but one is about transition from childhood to adulthood. And so the question is about struggles in that transition. But I'm going to add if there was anything in particular that helped you navigate that change, if you will, going from high school and whatnot into after high school life. So again, struggles, and then also what was maybe helpful during that time frame. And Stephen, would you mind going first?
Yeah, I'll start.
Great.
And I think what was a challenge for me was getting ready for college. And maybe I even didn't understand how much of was a challenge it was. Maybe my parents even had a greater understanding than I did. And the reason why I say that is, I remember in high school, my parents would sometimes say to me, take a couple of days off of school, go with your older sister to her university and hang out with her for a few days and then come back. We'll write you a note for your absence. And so I did. And I found it to be a wonderful time because grade school, like for so many of us, is such a horrific time with bullying and misunderstandings. And it seems like everybody focuses on how much you're like somebody else. But when I went with my sister, I was absolutely amazed that people were friendly, class discussions were interesting, and I was shocked that even if people didn't know me, they would still talk to me. And I found that to be true when I eventually got into university. And I found out what my parents did was a sort of primordial version of the college experiences or pre-college experiences we have today, where college students, and I've seen this also particularly for autistic college students, those who are going to college, they'll be invited to come on campus for a couple of weeks during the summer just to get used to it, to transition into what college life is like. And so it will be familiar to them when they attend college as a student.
Excellent. Thank you. All right, Chris, how about you?
Yeah, I found the transition from high school to college also challenging. I was diagnosed when I was 11, but my parents didn't tell me about my diagnosis until I was 13. And the information they provided wasn't very much to go off of. They literally said, this is why you have trouble making friends. This is why you have trouble in school. Don't use it as a crutch and no one should know about it. And so being a 13-year-old, going through puberty, and as a transgender person also going through female puberty, when that was definitely not something I was interested in, was a lot to take in. And so when I went to college, I didn't have that knowledge and that acceptance with who I was as an autistic person. And so I think it is important with young people to share their diagnosis information with them and give them, the most comprehensive, accurate supportive information about their diagnosis to them. And yeah, when I went to college, it was quite a learning curve, learning how to advocate for myself. I was also homeschooled for most of my K through 12 education, so it was a learning curve just in just how school works and how I myself was a person, as a LGBT person and as an autistic person. And so I think it would have been really helpful if I had gotten and I known all that information about myself well beforehand, so I could make those kinds of mistakes that you make when you're in grade school, that teaches you how you learn, instead of having to do that in college where the stakes are a lot higher.
Yeah, sounds like you did it. But yes, I agree that that's a lot. So thank you for sharing that. That's really helpful. All right, Ariel, how about you?
Yeah, so this is on the heavier side, and I'm definitely not sharing this to try and scare anybody, but I think it is important to talk about that some people may not know that almost 90% of autistic women report experiencing sexual violence, and on often multiple occasions. So they're three times more likely, those women on the spectrum, to experience sexual abuse. And that's actually 3 times more than men. And so for myself, I was a victim of sexual violence many times, and there's different reasons for this for different people, but a lot of it has to do with sort of this like gullibility and not understanding and struggling to interpret other people's ill intentions and not expecting others to have bad intentions, and just sort of taking people at their word. And so I think that that's something that I definitely was impacted by and had to learn the hard way. And unfortunately, my parents didn't know that I was autistic, and their approach was just kind of like the don't have sex, like that was education. And so I think it's really, really important that we're talking to, not just women, but autistic persons about safety, sexual safety, normalizing talking about these things and recognizing when people have ill intentions.
So incredibly important. Thank you for sharing that. I know that's not easy. And yet it is so important. And I think, again, for the clinicians who are here listening, or for the really anybody actually, this idea that, oh, autistic people aren't sexual, I mean, whatever, right? Like that's also a massive misconception. And there's so much that we can be doing. I'm speaking just as a pediatrician, but I know that when I'm seeing longitudinally my patients, we consistently start talking about safety, puberty, sexuality, bodies, choice, like touching and all of that kind of stuff. Very early, and really encouraging, even though I know it's uncomfortable at times. And they all laugh. I mean, I'm the pediatrician, right? So they all are like, oh no, here she goes, says the kids and sometimes the parents. But it's an important thing so that you have less of a chance for having those inexcusable moments, right? Like it's inexcusable that people are taking advantage of others because of their seeing the world in a way that we would all hope we could see it, but that's unfortunately not reality. So thank you for sharing that. That's really, really important. And again, I don't think that pretending like it's not a thing will make it any better. And so those statistics are staggering. And I think it's really important for all of us to be well aware of that. So thank you for sharing that. Okay, Nicole, what do you think? How about that transition to adulthood? What struggles? What helped?
I had a lot of issues with anxiety and depression and had a lot of meltdowns. And when I was 12, I found a fantastic primary care physician that directed his questions at me. And even though it took several years of seeing him for me to talk to him, he continued to talk to me. And because of this, he made me feel like he cared and that I could trust him. So transitioning to an adult provider was really hard for me because with my past medical experience, I learned that doctors don't care, so why should I dignify them treating me like I don't matter with a response? But eventually my pediatrician had to transfer me because the insurance wouldn't pay for me to see him, and he personally called the adult provider to tell her about me.
Yes, that's amazing. I love that. I love it most because you had somebody in your corner, right? And so I get a little teary-eyed, but it's like you had somebody who was willing to spend time getting to know you, listening to you, and treating you as you deserve. That's incredible. And then what I really love is that that pediatrician in this case, but I'm sure there are others that, could choose to make this part of their practice, picked up the phone and made that what we often call kind of warm handoff or, transition of care, which is, by the way, how it's supposed to be done. As somebody who's published a lot on this area around transition to adulthood and thinking about, kind of the standards of care in this space, that's the way it's supposed to be done. But you're right. That's not very common. And so I'm so glad you had that experience. That's absolutely awesome. Really, really glad that you had that experience. Okay, so we have time for a couple of more. And so I want to, I like this question. I like them all, but this one's a kind of a neat one. I'd love to hear your guys' perspectives. So this comes to us from a pediatrician who tries to speak and interact mainly with the patient, so her kid patients, no matter if they are 2 days old or 21 years old. So like, again, all across the all across the age ranges. Do you have any recommendations for when a parent interrupts and tries to make the doctor in this case only communicate with them? She goes on to say that it always worries her because she doesn't want to embarrass the parent, but she also does really want to hear directly from the child. And so I would love to hear your guys' kind of like top line thought about that and like how can we do what we are trying to do, which is talk to the kids, but obviously not ignore the parent. I know that that's not what this clinician is saying, but she does want to hear from that child. And I have this experience pretty often in my clinic too. So I'd love to know, what are your thoughts about how do we kind of set the boundary, if you will, around letting a clinician speak with the child, but then obviously still very much engaging with the parent as well. So let's start. Ariel, do you mind starting? And then we'll go to Chris.
I'd love to. Great question.
Mm.
So I know personally speaking, just going to all kinds of different providers for my son, that I don't know what kind of a day that provider's having, if they're exceptionally booked. And a lot of times my worry is that I really need them to hear certain things that I need to tell them that my child has been experiencing. And so I would have a lot of anxiety that I need to hurry up and get these things out so that they hear them all so that they're addressed. And then we can do whatever needs to be done. So for me, if a provider were to say, and I've had providers do this, so I'm going to give you some time to talk to me, and then I'm going to give some time to interact with the child. And so whether you do one up front or one or the other, I probably would suggest the parent up front, as long as you're okay with having a strict time boundary. Like we're going to do this for like 10 minutes or 8 minutes, and then we're going to move over here. But just letting us know that, especially if we're neurodivergent and anxious, is going to really help us know, okay, they're going to talk to me, I'm going to get my turn, I'm going to get my turn.
Excellent. Love that. Chris, how about you? What would you say?
It's kind of a little bit out of my wheelhouse. I'm not a parent, and so I don't have a child. But I think that I think it's also helpful to know that sometimes, I've seen a pattern in the community where a child will be diagnosed, and then the parent will also receive a diagnosis later on because of that child. So I think that it is important to incorporate that parent's perspective, because that parent might also be autistic, and so whether they know it or not, they're autistic, and so they can provide some insight into that. But I do think it is also important for the pediatrician to also talk with the child directly. So I think I just will just echo Ariel's comment about, trying to create some boundaries and work through those boundaries with the parent.
Love it. Yeah, those are great suggestions. Stephen, what would you add?
Yeah, well, I think the idea of boundaries is very important. And what I would say is first, I would validate the parents' need to get the information out to you. I think it was Ariel who mentioned that. And then you slip in a however, or maybe in addition In addition, it's important for me to hear it from your child. And I'd go about it that way.
Yeah, I love that. Excellent. Nicole, do you want to add?
What my doctor did was he would talk to me first about how I think I am doing, and then he would talk to my mom and ask if she had any concerns, and would often talk with her outside of the room if my mom had anything she didn't want me to hear. He even gave my mom his cell phone number, and she could call him when she was feeling overwhelmed or stressed.
Wow, I sounds like I need to meet this guy of that you work. What an amazing pediatrician you had. That's incredible. Awesome. 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 Okay, thank you. I think that's really helpful. And I do agree, setting those expectations, I think can be really helpful also for the kids. I know when I start to really lean into, I mean, I'm always talking to my kid patients. However, when they get a little older, it shifts quite a bit and they start to be the primary kind of historian, so to speak, is what we call it. And I know they always are kind of looking at their parent like, wait, am I supposed to talk to her? And so I love that. I think of it as a way to teach them some self-advocacy skills. So as they are learning how to talk to me, I hope that that helps them learn how to talk to the next doctor or even to their teacher, or what have you. And so it's a really powerful, opportunity, I think, to model, to guide, to mentor, and I would say learn. So for me, that's the times that I love it, right? That's why I still love and continue to see patients, because I get to learn so much when I'm talking to again, they're kids, but kids in my practice, it's amazing. So love it. That's awesome. Okay, so last question. We are going to run out of time here in a minute, but we've still got a little bit of time. So my last question is, was there anything that your parents did or said when raising you that you felt really helped you feel accepted or loved? Now, caveat, it's possible that there wasn't anything and it was the opposite. And so you can decide how you want to take that. And so I know that is it's kind of I love the question. And yet I also understand that it can sometimes trigger some emotions. And so you guys decide what comfort level you have with that. But let's start with Stephen, and then we'll go to Ariel, and then Chris, then Nicole.
All right, sure. Well, I think the best thing that my parents did is that they accepted me for who I was, but at the same time realized that there were a lot of challenges that needed to be addressed and overcome if I were to lead a fulfilling and productive life. And an example of how that took place is that my parents used the word autism in the house, just like any other word. Like you talk about somebody having blonde hair or wearing glasses or how tall they are. We didn't know much about autism, but it certainly helped explain a lot of differences. So in that way, I've always known that I'm autistic, and there wasn't this big adjustment that often occurs when somebody finds out, either as a child or an adult, and they get disclosed too that they are autistic.
Great, thank you. Okay.
I think the best way for me to answer this is to say what would have been most helpful to me. So what would have been most helpful to me would have been lots and lots of patience, and an understanding that I was a little child that cared very deeply about doing well, and that anytime I was making mistakes or seemed not to care or wasn't paying attention, that it wasn't because of those things, it was because of my own personal experiences, and that that's okay, and that if doing my best was what I was doing every day, then that was good enough. And also, again, that I would have really, I think, have excelled. I was a high school dropout, by the way, just so you guys know. So if I would have ever heard, like, you can go to college, you can do this, you can do anything you want, I think I would have got there a lot faster. So just encouraging your children to follow the dreams, I think would have been very helpful.
Awesome. Thank you. Chris?
Yeah. So my parents, they did make some mistakes and that I discussed earlier, but I think on the other hand, they did do some things that were very helpful at the time. So I was in public elementary school from kindergarten through 5th grade, and I was struggling a lot. And my parents, the summer between 5th grade and 6th grade, they sat me down and they were like, you have been struggling a lot in school. Um, would you like to try to go back to your school next year, or would you like to be homeschooled? And I was, bullied a lot at the time, and I was also a kid, and I was like, homeschooled, I can stay home and I don't have to get up early. I can have like actual real food and not cafeteria food. Um, and I was like, well, okay, I guess that makes sense. Let's do homeschooling. And uh, so I was kind of passed through school. I was, even though I was in 5th grade, I was probably more in like 3rd or 4th grade. And so my mom and we worked really hard, basically nonstop from 6th through 8th grade, and I was finally caught up. And then I went off to a private high school for a year, and I think that having that experience of experiencing all different kinds of the way that school works, from public school to private school to homeschool. I did dual enrollment for in community college and in high school in my senior year of school. And so I think that was the silver lining of it all, was that I got to experience all different kinds of the way school works. And I think that just being in an environment where I was away from that kind of bullying was really helpful. So I think my parents deciding and collectively with me to homeschool me was a really good decision on their part.
Awesome. Thank you for sharing that. Okay. Nicole, what do you want to add?
My grandma Marcella was the person that made me feel loved the most. She just loved me like only a grandma can. She made me oatmeal every morning and let me help her with her crossword puzzle on the easy questions. And she just made me feel special and valued when often I didn't feel at home with my dad.
That's awesome. Thank you. That's helpful and so profound, right? It's in those small moments. I think a lot of parents, myself included, just any parent, right? We think about these kind of monumental boulder moments where it's like, oh, I did this and that's what made my kid feel loved, right? But it's often in those moments where it's the oatmeal in the morning, it's the crossword puzzles, it's the playing catch one afternoon or whatever, right? Like those moments are powerful moments. So Nicole, thank you so much for that and that consistent love that it sounds like you experienced from your grandma. That's amazing.